The views and opinions expressed in this video are those of the speakers and panelists, and do not necessarily reflect the position of the ETHOS Institute for Public Christianity and its founding institutions and organizations.
Is Jesus God?
Migrant workers and human rights from a Christian perspective.
Marriage and family.
ISIS presents a much bigger threat.
How do we integrate the Bible with our scientific understanding?
Are you able to actually describe and articulate clearly your own sense of purpose in life?
It's a real pleasure to be here and also a great pressure to be here. If you get a headache listening to all of this, I want you to know that you're not alone. Experts get migraines trying to wrap their heads around this issue because it is ever evolving and very challenging on many different fronts. So kind of maybe put your seatbelts on. We're going to go for a ride, and it's just going to kind of give you a bit of a headache. I apologize first. But the transgender movement is something I'm glad that we're finally getting to talk about, because it's really all about making sense of our experiences and making sense of who we are and the sense of self. And that doesn't happen in isolation. Our sense of self comes in the context of each other. And so we're going to start tonight with some definitions, just to be sure that we're all talking about the same thing and why we're here. Some treatment and outcomes from the treatments, as well as some suggestions for parents and educators, building on the points that Bishop Solomon has already shared. So what are we talking about? He has already mentioned the fact that our biological sex is binary, male and female as God created us to be, and it is determined at conception. This is not something that is assigned at birth, which is the current terminology. Nobody assigns our sexes except for possibly in the conditions where you have disorders of sex development. And these are very, very rare occasions where some children are born with certain disorders, and so then the doctors have to sort out their makeup to kind of make a recommendation to parents as to how they should be bringing up their child. But again, this is the rare condition, and it is not a third sex. There are only two sexes. The transsexual person is the one who wants to experience themselves as the opposite sex. So this was traditionally the way gender dysphoria was conceptualized, is the person who thinks of himself or herself as the opposite sex and wants to change. So then they would take on what's called a transgender identity, because these are people who then feel that their mind and their bodies don't go together. Okay, so Bishop has mentioned many times over this gender dysphoria, which is the current terminology, formerly known as gender identity disorder. What exactly is it? It's this marked incongruence between a person's experience or expressed gender and their biological sex. And not just this marked incongruence, but the distress and impairment that comes about as a result of this incongruence. Okay, so you've got two parts to it: the incongruence and the distress that comes from the incongruence. There are at least three different kinds of gender dysphoria, which I will get into in a moment. But it's important for us to know that not all persons with a transgender identity experience gender dysphoria. In other words, I could have this incongruence but not be distressed about it, and therefore I don't meet the criteria for the diagnosis. Okay? And then at the same time, not all persons with gender dysphoria will identify as transgender. And the reason for that is some people with gender dysphoria actually see themselves as heterosexuals, for example, because that's who they believe themselves to be. And so that's their perception of self, even though they experience this kind of incongruence. When I get into the descriptions of the three types, you'll understand what I mean. So there are basically, this is Blanchard's typology. Ray Blanchard has studied transsexuals predominantly for many years. And basically what you have is the types of people who experience their gender dysphoria in childhood. You see them playing with opposite gender toys. They actually say they are of the opposite sex, and they are highly correlated with homosexuality. They kind of grow up in their adolescence and adulthood expressing a homosexual orientation. The second kind occurs only in males, and these are men who get turned on sexually by thinking about themselves as female. So these are not homosexuals in orientation, but they get turned on by thinking about themselves as females. So then they might end up cross-dressing for that high. Someone that comes to mind could be the former Bruce Jenner. Okay, we don't know exactly what he is, but he comes to mind when you think of this category. The third category are the people that we're most concerned about, which is kind of why we're here tonight, because there's this explosion of adolescent females who are identifying later on in life. We call this actually kind of late onset, because most of them, if they express gender dysphoria, usually you can see the patterns in childhood. But these adolescents have no expressions in childhood and suddenly become transgender in groups. So that's why there's a lot of, we're wondering, how did this come about? And it happens in groups. The pattern has been really phenomenal in the UK, Canada, US. You can see that the curve is extremely high compared to for boys, right? So transgender girls are identifying in this way in huge numbers. And that's what we're most concerned about. So Eliza Lian, the researcher who has noticed this, calls this rapid onset gender dysphoria. It's not a formal diagnosis, but it's a pattern that she's seen, and not just her, but many others in Europe and parts of Australia as well, with very high ratios of girls to boys experiencing this. And then they seek transitioning, they seek sex reassignment surgery. The very famous case that some of you have heard about is this Kiara Bell, who in the UK has turned around to say that, the doctor should not have allowed her to do this. And so these are people who are detransitioning in their 20s, regretting their decisions of the earlier teenage years. There's also a lot of severe psychopathology associated with these conditions. What we call comorbidities, meaning to say there are other conditions that co-occur with the gender dysphoria. And I think that's why we really need to take time to understand what's going on for them. Why is this explosion happening? Well, there's a great deal of visibility with regard to transgender issues all over the place, right? It's all over the internet. It's in our movies. It's in Disney. It's everywhere. So there's this kind of glamorizing and celebration of the transgender identity. So that, plus the kind of liberalized approach that the medical professionals have been taking in terms of how they go about assessing, diagnosing, and treating gender dysphoria. So what contributes to someone's gender identity? Well, there's a lot of biology involved. Physical energy expenditure, and this is observation of Kenneth Zucker, who has done a lot of work in Toronto. He's the man who's done the most amount of work with children. He says that just the energy level itself is inverted in children with gender dysphoria. So boys might be subdued, quiet, girls, of the opposite extreme, perhaps. Psychosocial factors are things like, parental response. There are some kids whose parents actually dress them up this way, cross-dress them, and I'm not sure what's behind that. I mean, you could speculate about that. Social ostracism, the bullying that occurs, boys get called sissies, girls get called tomboys, and so they lose out on that socializing with their own peers, and then they feel safer with the opposite sex peer group because of the ostracizing. So these experiences do play into the experiences of kids with gender dysphoria. Social contagion is what we mentioned a bit earlier already, but you see, the thing that Kenneth Zucker has observed is that children have something called gender constancy. It's like object constancy. Most kids, by the time they're 2 to 3 years old, kind of know what boys and girls are. Pretty fixed, grandmas, grandpas, father, mother, they have those categories in their heads. And usually by the time they're 5 and 7, it's all very clear to them, boys and girls. But then there are some children for whom this gender constancy is delayed, and maybe even up to 9, 10 years old, it's just not very clear for them. For them, it feels like a fluid thing. Some co-occurring conditions that we have observed is that, autism is one of those things that seem to occur a good deal among people who have the transgender identity. It's possible that they are gendered in their obsessions, because we know kids who are autistic can be very single-minded on certain things. And if they see this diagnosis as the reason why they're so weird or why they feel they are left out, and this is the meaning that they have made of themselves, then you can see them pursuing this diagnosis. Psychodynamic mechanisms, it's possible that sometimes, especially in our Asian culture, we highly value sons over daughters. Sons are the ones who get inheritance. Girls get married out, especially in the Chinese culture. So you can see that perhaps there are some parents who may have some conflicts about that, and issues for having perhaps too many daughters and not enough sons, and then desiring a son. Those feelings do play into how we end up bringing up our children. The etiology of gender dysphoria, this is the HRUZ is a pediatric endocrinologist, and I think it's very humbling to recognize that the exact cause is really unknown out there. It's probably both genetic as well as environmental causes. And what we recognize is it's probably a combination of many things. It's multifactorial, and different things factor into the development in different people. So there isn't a single track. And I think this keeps us humble, because it means that we have to listen very closely to the individual experiences, and we cannot treat them as one kind. So the transgender umbrella is very broad, and there are many different kinds within that. And we have to listen very closely to understand what's in their experience. For some, it's significant childhood adverse experiences, sexual abuse, physical abuse. Those kinds of experiences can be extremely traumatic and cause some level of dissociation. And so we listen very carefully to people's stories. Dr. Tsoi, formerly at NUH, went into private practice as the person who's been the longest in his treatment of transsexuals in Singapore. This is what he's observed in his studies, that dads are less involved and less caring, and they have weak fathers and uninvolved mothers among male transsexuals. In the families of female transsexuals, you kind of have moms being less involved in their upbringing, and mother-daughter relationships being less satisfying. It doesn't mean that, as a parent, you don't have to panic if you feel like these labels fit you, because it doesn't mean that just because I'm like this, my kid's going to grow up transsexual. But it does mean that for many transsexuals, this has been the kind of their experience. I think he sampled something like 200 transsexual men and 100 transsexual women to get these descriptors. So why are we here? We're here because there's a great deal of human suffering. It's a very painful thing to have the sense that your body doesn't match your mind. And too many young persons have gone through very life-changing medical interventions for what could be just a transient experience. And so I think that's why we want to be very cautious and kind of slow the whole thing down. The idea that sex isn't binary is very problematic, because it gives you a lot of misplaced hope. Some of these young people really, truly think that I, as a female, can be a male. And it doesn't work that way. Our bodies just cannot be malleable to that extent. The internal things are just set as God has intended. And so they end up with a great deal of maladjustment post-transitioning. Doctors actually, and here's the truth, don't really know which patient is going to persist and who's going to desist in their dysphoria. They cannot tell you. They're not able to look in the crystal ball and say, for sure this one is going to carry on, this one is not going to. Bishop Solomon has already mentioned the studies that exceedingly over 80% of kids are going to desist. They're going to drop that idea that they are of the opposite sex before they hit puberty. So it's not something that kids cannot outgrow on their own. And I think we don't have to be too quick and panic and think that something needs to be done in the way that may actually make the thing persist even more, the dysphoria, I mean. So all of this is being done with a lot of that ideology behind us, and the ideology is really to some extent impeding science, because there are some topics that you are not allowed to study in universities. Like if you want to do a research on desisting, there are some universities that won't allow that because they are afraid, of the cancel culture. What's the true prevalence? It's hard to say. It used to be very, very small. As you see, the numbers, according to the DSM-5, which is the Diagnostic and Statistical Manual that psychiatrists use, the numbers were very, very small before, but it's exploded over the last few years. I would say since the year 2000 onwards. And so this is really something that really needs to be studied and to be understood more thoroughly before we jump into treatment. Eliza Lian last year took a look at 100 desisters and brought them together to understand their stories. And for many of them, trauma was behind their reason for transitioning. Traumatic backgrounds, abusive backgrounds, it's their way of trying to escape pain. Give you an example. If a young boy has been cross-dressed and gets a lot of wonderful attention as a female, gets a lot of abuse from his parent, is sexually abused, he's going to think that maybe I'm better off as a female, because females get good attention and boys just get beat up and boys just get abused. So these seeds can be planted in their minds early on. The dysphoria for some and transitioning was for some due to homophobia, which means to say they had a hard time accepting themselves and the same-sex feelings that they had. And so for some of them, in order to think of themselves as heterosexuals, have to make that transition. I don't know whether you're following the logic here, but if I reject my own feelings and I cannot live in my body as a female attracted to a female, then I'm going to think that I have to be a male in order that I may be attracted to a female. Again, peers, social media, it's really hard to understand the role of this, but it's the soup that they're sitting in, and it's the environment, the primary environment. And if you think about these kids in their echo chambers, it's really hard for them to think otherwise and to consider other points of view as to why they are the way they are. For some, the dysphoria is rooted in misogyny, which means to say it's a society that doesn't treat women right and doesn't give women equal opportunities. So for some of them, they feel like, well, I'll be better off as a man. I have failed as a female. Maybe I'll be better as a man. And they actually think they can make that crossover. Treatment approaches for pre-pubertal children with gender dysphoria. There are kind of three approaches that are being taken, and this is Kenneth Zucker's material. He says that active psychosocial treatment can reduce gender dysphoria to bring the child's gender identity more into congruence with their biological sex. So this is kind of his approach, and this got him into a lot of trouble up in Toronto because they felt he wasn't being affirmative enough. The second approach is the wait and see approach, which kind of makes the assumption that it's hard to predict where the kid's going to go long term. And so the clinician kind of watches and waits and helps make the adjustments along the way. This is very unpopular because people feel like you're neither here nor there. Gender affirming is the third approach that you have all heard about a great deal, because it's about the fact that we should, affirm the person's identity, whatever that is, and socially transition them. Now, here's the problem with treatment, right? With puberty blockers, right away, you have the suppression of bone mineral density and growth. Puberty blockers was developed to treat what's called precocious puberty, which is to hold back kids who are approaching puberty far too fast. It was never meant to be used on kids who wanted to transition. So when you hold back puberty in an abnormal way, you're actually setting the child up for a lot of problems in the future. So if they move on to cross-sex hormones, which is the natural progression, then they end up with osteoporosis and other permanent types of problems. There are some kids, for example, with irreversible deepening of their voice because their vocal cords have thickened if they are girls taking testosterone. So here's the progression that you can see, right? They go from social transitioning, they use puberty blockers, and the next step over is to use cross-sex hormones and sex reassignment surgery. This is just happening far too rapidly in Europe and parts of the West. Kenneth Zucker says, gender social transition is supposed to help the gender dysphoria abate, but the problem is it actually promotes it. It helps it to persist because you're going to move on to the next step, which is the use of puberty blockers as well as the progression towards surgery. If we leave these children alone again, chances are they will desist on their own. Long-term follow-up studies, as Bishop has mentioned, is been rather dismal. There are a lot of psychological problems that these people continue to have post-surgery, as well as suicide attempts and successful suicides, not just in Sweden, but Netherlands and Denmark too. And there are plenty of studies along those lines. Paul McHugh, who was mentioned by Bishop Solomon as well, says that, there are studies at Johns Hopkins back in the 70s already showed this, that while people did better in the sense that they enjoyed their changes, they were still facing a lot of problems interpersonally, and whatever problems brought them into treatment was not solved by changing their bodies and their genitalia. So he says at the heart of the problem is confusion over the nature of the transgender person. This psychiatrist says sex change is biologically impossible. People undergo this not to change from men to women, but become feminized men or masculinized women. So we have to understand that this is problematic, isn't it? If kids really think that this can happen. Stella O'Malley is an Irish woman who has studied the kind of the detransitioning process as well. So you can imagine that a person starting out with a great deal of distress would put a lot of hope, needs hope in something, right? So they see this form of treatment as something that will give them a sense of belonging, because then I'll be able to be part of a larger group. When you are treated with testosterone as a female, you feel so powerful, you feel confident, you feel strong. And so then this expectation that I'm going to be a man, but then it's met with disappointment because you're not a man, you're kind of cosmetically, outwardly only in that way, a man. So these people get lost in their transition with a lot of regret, anger, and some of them then detransition. Others have coped in other ways, and some taken their lives as well. 60%. So she looked at these 100 people, girls in particular, and asked them what made them detransition, and said, many of them said, well, we just got more comfortable identifying with who we were at birth. And others said, the hormone stuff was just not working for them, was too difficult. And then others said, gender dysphoria really perhaps was just a symptom, not the cause of their problems. And then, of course, the discrimination that some faced, as well as coming to an understanding that really the issue is my sexual orientation and not gender dysphoria. I want to show you the paperwork that was produced in court for Walt Heyer, who transitioned and lived as a female for 8 years, and then became Walt Heyer again because he decided this wasn't for him. If you look at where at the bottom of the first page, where genetic sex is noted by his surgeon, he is still a male, and his internal morphology is still male. So that part of you doesn't change with surgery. At the best, you can become neuter in terms of your hormonal sex and your gonadal sex, because yes, we can remove your testes and your ovaries, and you will become sterile, but it doesn't change who you are. So for him, he was successfully transitioned back to the male identity, because that's who he was, and that's what he was able to pursue as a result of the fact that internally he was always Walt. Places like France, Sweden have really, and Finland have hit the brakes with treatment because they've come to recognize that there is no test to distinguish between who's going to persist and who's going to desist in their gender dysphoria. And so they are also cautioning parents to please pay attention to the addictive role of social media and what pumping that material into the mind of a young person can actually do to how they see themselves. So here's our response. I'm going to recommend that we refrain from premature labeling, that we really try to understand the core issues of these young people and try to lean in to hear, what are these feelings all about? Why am I feeling this way? What are the feelings telling me? And help them make meaning of it. The fact that I'm attracted to my own sex, what does that mean? What is attraction? What am I feeling? Is it admiration? Is it love? What is love? So is it a sense of attachment? Is it a desire to belong? What is it? And just listen closely to what their heart is needing to tell us. Let's encourage spiritual growth through real honesty with God and with each other, and walk with each other and hear the heart of the matter. That to me is true affirmation. Really affirming our young is really listening to their heart and walking with them. Teach them the beauty and the value of God's creation. And when I say that, I mean that there are many ways to be men and women of God. And there isn't one way to be a woman or one way to be a man. And what I mean by that is there are many roles that we can play. And you could have a sensitive boy who may be a really good teacher. He doesn't have to, do the stereotypical types of work that make him feel more masculine. When you have a child who needs treatment, make sure these are questions that are asked. You want to know what are the long-term and benefits as well as risk of the approaches that are being taken. Are there alternatives? What's the evidence? What's the prognosis with and without treatment? What happens if I pursue and what if I don't? What are some safety and effectiveness measures that have been that need to be communicated? For example, you might have to be very clear with the child that this means that you will never have any children. But when you're 16 years old, not having kids is not a big deal. But that's a very different mind at 26 and at 36 and 46. So you have to think long term. The people who are detransitioning in their mid-20s after regretting their decisions of their teenage years. So in a nutshell, there are many labels. We need to understand each person individually, and we shouldn't prematurely label anyone. Persons with gender dysphoria are really a vulnerable group, and they need a lot of support. They need a lot of help. You can see from the studies their vulnerability before transitioning and even after transitioning. Before surgery, after surgery, they're still vulnerable. Good treatment to alleviate gender dysphoria meets the heart of the matter and looks at long-term consequences. It's not just alleviating the dysphoria for the moment or even for a year or two, but it's the long-term thing. We know that with the use of hormone treatment, it's for life. The rest of their lives, they will need the hormone treatment. And that's something that is very hard to keep up with. Create safe spaces for people who don't meet stereotypes, and just allow children to express themselves in a manner that feels maybe help them to kind of expand their narrative and help them see that it doesn't have to be the stereotype, but it also doesn't have. It can be just a variation of. I'll give you an example. If you have someone who is very firm in their gender identity, it's really a lot of fun that you can have with them, in the sense that you could give them high heels. My daughter went shopping, and as a 6-year-old came home with high heels and Hot Wheels. So she had high heels that she could play in, and she had Hot Wheels that she could play with, and so it's just a way to see that people can grow in a variety of different ways and be exposed to different kinds of toys without it having to have any kind of implication on who they are as boys or girls. We need to address sexuality in the church and as well as in the homes, especially allowing people to understand what it means when they have same-sex attractions, because having an avenue to talk about this is very important, so that they're not hiding and they are not finding avenues to express that in ways that are hidden from people who really care about them. What are some resources available? Sex Change Regret is by Walt Heyer. He has a website there for people who are detransitioning. Restored Hope Network is also for Christians. Person and Identity is a Catholic website. It's full of very thoughtful compositions. Gender Resource Guide is for anyone. It's for parents. It's just an educational tool. Parents of rapid onset kids is a site that gives a lot of support for parents trying to cope with the fact that child has come out to say, I want to transition. Fourth Wave Now has a lot of experts writing on this website that you can get a lot of good information from as well. Help for Families was set up by a woman whose father transitioned. And so she decided, we really need to help family members cope with this. It's a very disturbing experience to lose a parent in this very strange way. Other resources, the female same-sex attraction is not very well understood. And so Janelle Holman has written about this. And I think it's a really good resource for people who are in the counseling area especially. Brian Shen is probably with us tonight, author of the middle book from CORE. He's working on a book called Affirming the Core, and really about understanding the issues surrounding homosexuality. And I think that's very important. Knowing the core is true affirmation. Irreversible Damage is by a journalist, Abigail Schreier, regarding the rapid onset movement. Bishop Solomon has already talked about the Sexuality and Gender Report. It's very comprehensive. I highly recommend it for anyone who wants a kind of a very deep view on this. And Paper Genders was written by Walt Heyer regarding that issue that gender really is only on paper. You cannot change your sex. You can only change what's on the paper. And here are some names for people who need help if you need to reach out to someone. I'm not receiving any money from any of them, but I feel like there needs to be some names up there for people who really need to reach out for some support and help in this area. And so there's a few up there for you. Okay, that's all I have for tonight.